Hello, my name is Dr. Mikhail Berman. I'm a physician practicing anti-aging and functional medicine in Palm Beach Gardens, Florida. Today I would like to talk to you about a pandemic that affects males over 40 years of age and even earlier. It affects all the males, or most all the males. It's been documented in several countries such as United States, Brazil, Finland, and Denmark. And it's not a COVID-19, it's not a coronavirus. This pandemic is not really covered in mainstream media, but it's well documented scientifically. And this is pandemic of falling testosterone levels in males independently of age. Testosterone levels reach its peak in a third decade of life in males, and then after age of 30 gradually declines at a rate of approximately 1% a year in a healthy males. Of course, in men who misuse drugs or alcohol or tobacco, or who has some chronic diseases, this decline, age-related decline, is going at a much faster rate. But in a normal male, it's a 1% a year. Scientists from many countries, including United States, compared the levels of testosterone in a healthy average males from 1987 till now, and they found shocking fact that testosterone level decline at a rate of 1.2% a year independently of age. And that means that the level of this hormone in a male in 1987, in average male, was 30 to 35% higher than it is today in a male of the same age. Unfortunately, in most people's mind, testosterone is associated with sex and looked upon as a kind of kinky hormone. But in reality, it's a very important hormone, because not only it causes the sexual issues, but more importantly, it causing the other changes in a general condition of health. Most males or men who come to me for evaluation and treatment complain of such as symptoms of testosterone deficiency as decline in strength, fatigue, thinning muscles, poor sleep, bad mood, feeling burnt out, over the peak. But testosterone not only causing these symptoms, testosterone deficiency and lower level of testosterone is also directly connected or related to the development of metabolic syndrome. Metabolic syndrome is an epidemic by itself today. It consists of such a signs as obesity in abdominal area, increase of abdominal fat, gradual increase in sugar levels, so-called pre-diabetes, gradual increase in blood pressure, so-called pre-hypertension, and decrease in the levels of the good beneficial cholesterol, HDL, which, if not treated, may lead to heart attacks, strokes, arteriosclerosis, frank hypertension, and frank diabetes, sugar diabetes. So my advice to men who are over 35 years of age is to go to their physician or go to the laboratory if they can and check their testosterone levels. And if their testosterone levels are lower than 350, seek medical attention for this dangerous problem. According to International Society of Study of Aging Male, testosterone deficiency should be treated in men with testosterone levels lower than 350 and symptoms of testosterone deficiency. And especially this should be done, the testing of testosterone, in men who are overweight, who have prediabetes and prehypertension, and have a low HDL cholesterol, because testosterone is effective in improving these parameters even after only 3 months of use. Testosterone is being discovered in the 1930s, 90 years ago, and is being used since then to treat men with testosterone deficiency, otherwise called hypogonadism. It's extremely well researched. There is more than 80,000 articles in Medline about testosterone. And if the treatment administered in a proper way, testosterone is may be life-saving, and it's practically doesn't have significant side effects. Of course, I do not recommend use of testosterone that is bought on a black market or without a proper medical supervision by a specialist who is experienced in treatment of testosterone deficiency. Thank you for your attention. See you soon.